Well, hello from Washington, D.C. This is former Congressman Mike Ferguson. I'm the leader of BakerHostetler's federal policy team here in Washington. Welcome to the next installment of our bipartisan webinar series, BakerHostetler Bringing Congress to You. Congress may be closed in the traditional sense, but the work of our government, of course, is continuing at a breakneck pace as Washington is continuing to respond to the coronavirus pandemic. That's why we here at BakerHostetler are delighted to continue our bipartisan series today with a star of the House Democratic Caucus. She's a member of the Ways and Means Committee. Congresswoman Stephanie Murphy from Florida is going to be joining us in just a moment. I'm very pleased to introduce my partner in this bipartisan webinar series, my colleague and fellow senior advisor here at BakerHostetler, former Democratic Congressman from North Carolina, Heath Shuler. Heath, we're gonna hear today from a star of the Democratic Caucus in the House and a leader in the Blue Dog Coalition. Now, Heath, tell us first of all, you know a little bit more about this than I do. What's a Blue Dog, and why is the Blue Dog group so important in the House these days?
Well, Mike, thanks for another great day for a webinar. Stephanie Murphy is an incredible leader, as you're talking about, and she, as a part of the Blue Dog Caucus, and a few years ago, there were several members of the more moderate members of the Democratic Party decided that the focus needed to be on strengthening our national security and also our debt and deficit, looking at the financial balance sheet of our country. And so many of these blue dogs John Tanner said it well, who was my mentor in Congress, said, you've heard of a yellow dog Democrat, that a yellow dog was squeezed from the right and the left of the party so much that the yellow dog turned blue. So I don't know if that was exactly how they got their term or name Blue Dog, but that's how I was told through the great John Tanner of the great state of Tennessee. But John is one of the godfathers of the Blue Dogs, and that was the story that he gave me. Don't know how much truth it is, but a Blue Dog is essentially someone that looks at the our fiscal house, and tries to keep it in order and keep people mindful of the debt and deficit that we're facing in our country.
Well, it's a great explanation. We'll look forward to hearing from Congresswoman Murphy a little bit more about that and why that's important these days. But in case you're just joining us, welcome to another installment of our bipartisan webinar series, BakerHostetler Bringing Congress to You. Again, I'm former Congressman Mike Ferguson. I'm the leader of the federal policy team at BakerHostetler, and I'm here with my co-host, my colleague at the firm, former Democratic Congressman Heath Shuler from North Carolina. We are going to be joined in just a moment by Congresswoman Stephanie Murphy from the Orlando area of Florida. You can submit questions that Heath and I can ask the Congresswoman. Please submit your questions using your control panel to the right side of your screen on this webinar. And let me also give you a heads up that our next bipartisan webinar will be this coming Thursday, April 9th at 12 noon Eastern Time. We're going to be joined on Thursday by another Democratic member of the House, Josh Gottheimer from New Jersey. I, of course, am from the great state of New Jersey, so I'm very, very pleased that we'll have Congressman Josh Gottheimer here on Thursday. So we're looking forward to that, and we are particularly excited to have really a star of the Democratic caucus. And as I said, Congress is out of session until later this month, until at least April 20th. But lawmakers in both parties are already hard at work. They're planning for the next coronavirus relief bill. Members of Congress are already talking about increasing healthcare funding, looking at hospitals and frontline healthcare providers. President Trump has been talking about pushing for additional economic stimulus with perhaps some spending on infrastructure. Heath, I guess it's not clear yet when we're going to see legislative action on that.
Well, yeah, obviously, I mean, it looks like that Pelosi sent out another request, and we talked to, that's unclear kind of what that infrastructure looks like and the amount. When we spoke to Senator Blunt last week, his infrastructure bill was kind of more in that 250 billion, and it sounded like Pelosi's more around that $1 trillion mark. And it'll be interesting to hear what Congresswoman Murphy has to say about, how do we ultimately pay for these things that the infrastructure I've always heard is like the 6-to-1 return on investment. It'll be very interesting to see what she has. So I'm very excited to hear her a real in-depth knowledge of what's going on, especially, a few days have gone by since the Senator Blunt was on. So I'm sure there's new things that have on the forefront for us.
Well, that's right, Heath. So now it's, Heath, you mentioned Senator Blunt, who was on with us last week. That was a great way to kick off our bipartisan webinar series, and it's time to introduce our guest for today. Stephanie Murphy was elected to the House in 2016. She's from Central Florida, Orlando, and its surrounding areas. She's a member of the Tax Writing Ways and Means Committee, including the Worker and Family Support Subcommittee, which oversees unemployment insurance and other programs that really at the heart of the congressional relief efforts so far. She's also on the Trade Subcommittee. She's obviously from the great state of Florida, which is really in the news as much as any state these days in terms of how this pandemic has been affecting communities and different parts of our country. And Heath, she also, as we were talking about just earlier, shares a little bit of congressional heritage of sorts with you.
Yes, I am so thrilled that the Blue Dog Coalition is in such great hands with a thoughtful, pragmatic leader like Stephanie Murphy. Before she was in Congress as a businesswoman, and also served in national security specialist at the Pentagon. So that really, having that business background and being a part of the really coincides everything that the Blue Dogs stand for. Very respected amongst the colleagues, looking continue to gain what I would consider a strength and influence in Washington. So I am so proud to introduce Congresswoman Stephanie Murphy. Stephanie, this is Heath Shuler and Mike Ferguson. Welcome to the BakerHostetler webinar.
Thanks so much, Mike and Heath. I really appreciate the very generous introduction, and it's always great to be back with BakerHostetler. I think this might be my third year in a row doing this event with you all, and just really, really glad to be here for a good conversation at there couldn't be a more critical time for our country.
Stephanie, this is Mike. As you mentioned, you've been a guest with us at our legislative seminar, which you're always a very popular guest and always making news and really sharing with our attorneys and our clients from around the country your very important perspective on what's going on legislatively. Of course, we at BakerHostetler have an important office in Orlando, and we've got a lot of great relationships with a number of our folks in our Orlando office and around that area of Florida. And even though we're not able to do our legislative seminar this year because of obvious reasons, we are very, very pleased that you've been able to make time to still join us in kind of a virtual legislative seminar of sorts, this webinar. Very, very pleased that you're able to be with us. Tell us first, how is it going in Florida? And I guess you must be back in Florida these days. And I guess when Congress will come back into session later this month, you may have to make your way back there. But tell us how things are going in Florida, because we've all been seeing Florida in the news so much these days with how the pandemic is affecting different parts of our country.
Absolutely. And as you said, I've been with you all for your legislative updates, and I'm sure my staff would agree that they'd rather I make a little less news when I'm with you all, but happy to be with you again. As it relates to being in Florida, I've been back in Florida now for a number of weeks. As some of you may have heard, I had to self-quarantine because of contact with another member of Congress who tested positive for COVID-19. I think, I'm grateful that I came through the self-quarantine without exhibiting any of the symptoms. But what I think it taught me, and I maybe a lesson for all of us, is that any one of us can be affected by this, and that this disease doesn't have any sort of filter on race, gender, age, political affiliation, whatnot. It is not discriminating, and it is ravishing the nation. And as I self-quarantined out of an abundance of caution, it was an example of how we all owe it to our fellow Americans to do what we can do to slow the spread of this disease so that we can build the capacity that is necessary to respond to it within our healthcare systems. And so by self-quarantine, I was trying to do my part, and now I continue to be on the lockdown that the state finally implemented a few days ago. And so am in self-isolation or I guess in lockdown with my family here in Central Florida. And as many families all across this country, we are figuring out the rhythms of teleworking and homeschooling, and all the while continuing to try to work on what's going on in Washington. But in Florida, things are slated, I think, to get worse before they get better. As far as the spread of the disease goes, we only recently took some of the more extreme measures to limit contact. And so we'll have to see how that goes. But I know that our numbers continue to grow at a pace that's a bit uncomfortable, a bit more in the southern parts of the state than in the other parts. But other areas like mine are beginning to show signs of increased uptick of cases as testing becomes more available, but also in hospitalization. So those are all numbers that we have to continue to keep our eye on. And then in the interim, as we try to get help to Floridians, whether they're small businesses or employees, we're running into a number of challenges that are part of a legacy of previous state governments. For example, we're trying to get the unemployment benefits out. And as you know, Florida was probably one of the first states most hardest hit by the public health decisions that would shut down restaurants and tourist sites and such. Our economy is still heavily dependent on that. And so we have seen a significant impact to our economy, maybe before some other parts of the country. Unfortunately, because this state over the previous administration had really scaled back the unemployment system, the capability that exists today to respond to that is lacking. And so as people are getting laid off, they're finding that they also cannot access their unemployment. So the state is really beginning to feel both the health impact as well as the economic impact fairly severely.
Well, Stephanie, one of the, you kind of touched on it with being in the hospitality industry and travel and tourism, very much, but on a much larger scale than we are here in Asheville, North Carolina. What are you hearing from the folks about the impact that it's having on the businesses, but also are they starting to see any relief or hope since the CARES Act passed?
It feels a little too early to say whether or not the CARES Act is having the intended consequence or the intended outcome that we had hoped for it. I think, you know this, both of you know this, having spent some time in Washington and as legislators, bills are the results of compromise, and no more so than when you are in a divided Congress, as we are with a Democratic House and a Republican Senate and a Republican in the White House. And so the three bills that we have passed to date to address COVID-19 have both benefited and suffered from the fact that it comes out of a compromise process, a process where you have to negotiate with very different ideologies and come up with what can actually pass through. I'm proud to say that we did pass 3 bipartisan bills, but many of the proposals were altered in a way that I think might not yield the intended consequence or the intended benefit in utility for small businesses, or in my case, hospitality businesses, as we had hoped. And I'll give you a couple of examples. So Central Florida is looking at probably 350,000 unemployed, if not more. But because we are so heavily hospitality-based, restaurants, hotels, entertainment, all of that, and those were some of the first things to be completely shut down. And when I talk to my restaurant owners, they have seen a drop in revenue of 85 to 90% year over year. Even going to curbside and takeout isn't sufficient to make up for in-store dining. And or if you look at some of our bigger employers like Disney or Universal or otherwise, their parks have been shut down for a couple of weeks now, and probably going into the end of April, if I'm not mistaken, on their latest announcement. And some of these companies have tried to hold on to their employees, but at some point they're not going to be able to do so. And so in Bill 3, I thought the most important thing that we could do as a nation was to keep employees on payroll, to tether them to their companies so that they continue to benefit from health care, which is critically important, but also some part of their salary. And my proposal was an employee retention tax credit, which would have the federal government reimburse companies at 90%. I would have been happy with something short of that, like maybe Canada did, which was at 75%. What ended up coming out of the negotiations with the Republicans was a 50% reimbursement on just $10,000 of salary. That, to me, is disconnected from reality of what real payroll looks like for many of these businesses. What they put up instead was what's called a payroll protection plan. And that is a loan that then converts into some sort of grant. And there are a lot of issues with implementation of this loan. But we are where we are, and so our focus should be trying to make the programs that got passed into law work. But the PPP program has a lot of challenges because banks are unwilling to step forward and extend these loans, except for in a case where a small business already has an existing loan. So if you are a good small business and didn't take any debt on and didn't have an existing loan with your bank, you're at the end of the line for getting any kind of help. And, oh, by the way, you don't get this reimbursement. It's a loan, and that gets reimbursed at some later date if you can prove that you spent it on payroll. So, you know, all that to say that we are still trying to make sure that Package 3 gets implemented in a way that is most useful to our businesses. But we are running into some issues there, and some of that is in Treasury's interpretation of what Congress wrote, and some of that is maybe the congressional approach wasn't the best, simplest approach in this massive crisis. But nonetheless, we're trying to get those things implemented. And then we have another opportunity to fix that. People are talking about another bill, and I think of it as 3.5. Let's go fix all the things that we didn't get right that first swing, and try to be more generous. And I'll wrap with this one last comment, is that part of why the bill number 3 came out the way that it did, with these sort of cumbersome things, both for unemployment insurance as well as for businesses, is because there are competing theories in Congress. And none of those competing theories really apply in this moment. But the competing theories are, on the conservative side, people, when given the opportunity to take a government program, would rather do that than work, which I think is not true. They have an inherent skepticism about workers' willingness to work. But in this case, that is definitely not true, because even if a worker wanted to work, they can't show up to a place of work. So this is a moment for conservatives to set that skepticism about workers aside. The other challenge was that on the Democratic side, they are also guilty of trying to put things in that were progressive policies that may or may not have been specific to this COVID-19 crisis that we're facing. So my perspective and what I'm trying to push for in 3.5 is for us to set aside these ideologies that do not make sense in a pandemic. They do not apply. These rules do not apply. And take it from a perspective of what it's like to actually run a business. And a lot of my beef about the way that legislation has been written is that it's often written by a staff member or imagined by a member of Congress who has never worked in a small business or in a business at all, or ever been required to make payroll. And so that's why we're seeing all the issues that we're seeing. And that's why it's so critically important that we put our heads together, set aside these ideologies that don't apply in this moment, and try to make legislation and regulation actually work for Main Street.
Stephanie, this is Mike again. That's a really interesting point you're making. And I know that there are a number of your colleagues in the House and folks in the Senate who are looking at that next piece of legislation. I know, I guess the Speaker sent a dear colleague letter around just recently on, her vision for CARES 2 or, Relief Bill 3.5 or the different names that it may have. I know there are Republicans who are also interested in additional legislation, but some have said, let's see how the dust settles on this first and see what we need to tweak and what we need to change or improve. How do you see this playing out? You've mentioned one or two things very specifically that you wished were different in the previous bill, and do you see this next bill as an opportunity to get some of these provisions, your thoughts specifically, into this legislation? And secondly, so much of that bill, because it was written so quickly and it was passed so quickly, obviously, there was a lot left to rulemakings and interpretations and implementation by the Treasury Secretary and others in the administration. Are you and your colleagues working on more specific legislative language for that next bill to sort of leave less at the discretion of Treasury or other places? Are you trying to be more specific, more directive with that legislative language? Or is that just hard to do when folks aren't in Washington all together?
Well, so what I think is the upside of CARES 2 or 3.5 is that although there are members on the other side of the aisle who say we should wait to see how this pans out, Mitch McConnell has acknowledged that there should be a 3.2. So that's positive, that both the Senate Majority Leader and the House Speaker believe that we need to do a next phase. And I do think that the next phase does have to deal with ensuring that the $2 trillion is implemented in the way that it was intended, and probably provide more resources in that space. And I'm not somebody who thinks we should wait around and see the $2 trillion work its way through our economy, because I think this problem and what we're seeing is far worse than $2 trillion can address. And that's coming from somebody who's a fiscal, I'm fiscally responsible. I worry about our debt and deficit, but I also recognize that we are in a moment of real calamity, and that the error will be not acting big enough soon enough. And certainly to date, the experience and the feedback I've gotten from my constituents is your bill missed the mark. That 3.0 did some good things, but but a lot of people fell through the cracks. And those people are trying to get their last breath of air in hopes that that will get them to a place where real help is on its way. And so we owe it to those folks to get another package out there that actually addresses those gaps and addresses the people who were overlooked in the first bill and makes the necessary adjustments to the language. But we can also work with the administration on making regulatory adjustments. And I'll give a good example of what we did this week. So when they went to write the unemployment, or when they went to write the rebate check, $1,200 per adult, $500 per child, tapering off after $75,000 and $150,000 for those filing jointly. When they wrote those regs, they were going to require people to have filed a tax return in 18 and 19. But the reality is many of our most vulnerable are seniors, are the folks on disability, on SSI, all of that. Those folks, their income would have been well below a threshold that would have required them to have filed a tax return. And therefore, they would have been left out of the group of people who would have received this check. And so we flagged that. House Ways and Means Committee worked with Senate Finance, and they worked with the IRS and Treasury to make the necessary adjustment. And now they made a change to the regs so that you don't have to have filed a tax form in 18 or 19 in order to receive this check. So, we are working hard right now to take the feedback that we're getting from our constituents about what isn't working. Did you realize this calculation doesn't make sense for people in the real world? We're taking that feedback, and we are either trying to work it with Treasury and with the administration to change the regs and how they choose to implement, or we are we'll have to put that into legislative language if we can't get it done regulatorily. And then the other area where we're trying to make sure this works is that, at the state level, they especially for the unemployment insurance, we bumped up everybody's unemployment insurance by about $600 to try to get people to 100% of their pay prior to being laid off for a period of time so that they can see themselves through this crisis. Unfortunately, the way that it was done, some states they either have a shorter time period for how long they're going to give it, or they don't yet have the capacity. As I mentioned earlier in this call, Florida doesn't have the capacity to implement unemployment insurance because by design they created a system that made it very difficult for people to get unemployment. And so now we've given the state $60 million to implement the new rules that we put out at the federal government. And so I've been working very hard to put pressure on the state government to be responsive, to take the federal money and fix your system so that you can get these dollars out to all of these families that are, unexpectedly unemployed, not because of a lack of willingness to work, but because of this crisis. But get them this money so that we don't have people who are hungry or on the street. So there's a lot that can be done between now and 3.5 or CARES 2.0, whatever you want to call it. But it requires a lot of coordination, both federal, state, and local.
Stephanie, with Florida having such a large population, Medicare population, how has the hospitals in the region, how are they dealing with the situation? How are they preparing for if the pandemic continues to grow? And what about the supply chain from the hospital standpoint? Or is it starting to have more clarity, or are there still obstacles in the way moving forward?
You pointed out something that is one of the reasons that in January of this year, I wrote a letter to HHS and the Department of Health at Florida to coordinate to prepare for COVID-19. Florida sits at an intersection of tourism and more senior people, many of whom are on Medicare, some of whom are on Medicaid. And we didn't expand Medicaid in this state. But the more senior people who are more vulnerable to the virus, plus all of the tourism, made our state, I think, in particular, vulnerable. And so we wrote letters in January. We tried to sound the alarm bells. We held roundtables in our district about COVID-19, really trying to get people to move in front of all of this. And the bottom line is that there's still so much that has to be done. And the first thing that we absolutely have to do for our hospitals is to get them the supplies and the PPE, period, full stop. This is what our number one priority has to be. And I think it has to be coordinated at the federal level so that states aren't competing against each other and that we're making sure that supplies are getting to the hottest spots as they arrive. But if you look at the federal coordination of this pandemic, you have a supply chain manager in Admiral P, I can't pronounce his name, who is a logistics, Navy logistics guy who's put in charge of supply chain, and he's trying to pull in supplies from around the world. You have Jared Kushner, I don't know how to describe what he's doing. You have, Vice President Pence, who does the daily briefings with Fauci and I forget the woman's name. And then you have all the governors, and then you have individual hospital systems. And it is a complete and total free-for-all right now, where everybody is just scrambling to get the supplies, and they're therefore bidding up the cost of all of these products. And we have hospitals in our district that are still doing elective surgery because they feel like they have plenty of PPE, whereas we have hospitals in South Florida that are so severely out of PPE that they're asking frontline healthcare workers to do some fairly, personally risky things for these healthcare providers. And yet there's no coordination at the state level. There's no coordination at the federal level to get equipment to the places that are most needed. And we, as the federal government, we have thrown a lot of money at this issue. And starting from March 6th, which was the first COVID bill that we passed, which feels like a lifetime ago, even though it's only a month ago. But we provided a lot of resources, but without some sort of coordinating function and without a real implementation of our Defense Production Act that, creates more supply, domestically provided supply, it's going to be very difficult to see how we get resources to the place that need them most. And so from my perspective, I've been trying to coordinate with the supply chain admiral, the FEMA, Pete Navarro, who's in charge of Defense Production Act, with Vice President Pence, and with Kushner's office. We're trying to be that coordinating thing, but it's very difficult to get the attention that we need to get the supplies that we need for Central Florida. And the resources are there, but the failure in coordination from the executive perspective is astonishing. And it's one that I have a little bit of experience with, having worked at the Department of Defense during our response to the avian flu. And it's critically important that we know who's on first. And right now, I'm not sure that that's the case, and we're seeing it manifest itself in these sort of shortages all across this country.
Stephanie, this is Mike again. I want to pick up on that. Those are really important points, alarming in many ways. Talking about the supply chain, and you mentioned Peter Navarro. Of course, he's one of the president's, sort of trade and manufacturing advisors. He has been somebody who has been focused for a long time before even this crisis, trying to impact the global supply chains of various industries to encourage more American manufacturing, try to move supply chains from China and India and other places around the country. Of course, so many of our industries, our pharmaceutical industry, our chemical industry, our energy industries, and in so many different industries have sourcing or component parts or raw materials that are sourced from around the world, and it's such a complex supply chain now in our economy. And I know you, with your work in trade and on the Ways and Means Committee, are involved in many of these conversations. How do you see this playing out once this crisis passes? There are some folks who have said, look, this is not the time to upend our supply chain and try to move all the manufacturing back to the U.S. in the middle of a crisis. But at some point, this crisis will be past. How do you see our experience in this crisis maybe impacting that conversation? And what do you think about that and about Peter Navarro's advising of the president? And where do you come down in this sort of debate about American manufacturing versus global supply chains?
Well, I definitely think this crisis is going to sharpen people's thinking on the value of global supply chains, but also on balancing the need of having secure domestic production. And as you mentioned, I'm somebody who does believe in a free and fair and rules-based trade trading system. And I think we may overlearn a lesson here, and I'm already seeing the conversation shift that way among my already predisposed to be protectionist colleagues. You're hard pressed these days to find a free trade or a pro trade. I wouldn't even say free trade, because free trade makes it sound like you believe in a free for all. But a pro trade, as in you believe in trade within a regulated rules-based system, you'd be hard pressed to find a pro trade member of Congress these days, given the Democratic Party's natural proclivities, and then the Republican Party's unwillingness to speak out against this particular president. And Navarro, I think, has been the most stringent, maybe hardcore on this issue, and we'll probably see this as an opportunity to validate his idea that we shouldn't be involved in global trade. And I think that that's the wrong lesson to be learned. Certainly, there are things that we should ensure we have domestic supply and production of, and we should have critical access to those things. But you have to understand, too, that trade is just one tool of foreign policy. And what you're seeing with some of this trade, like our inability to access some of these goods, is a result of a broader foreign policy issue. The fact that China is prioritizing Europe is a reflection of the degradation of the relationship between China and the U.S. over the last few years. That is not saying that we should not make sure that we have appropriate preparedness that would mitigate against being caught off guard on a number of these issues again. But I think that if we walk away from this moment and the lesson learned is double down on protectionism, then we will basically forego one of the key reasons why we had such an incredible growth in our economy over the last 50, 60, 70 years, because we were a leader in trade, setting the rules and benefiting greatly from that. But I do worry about what lessons we end up taking away from this, especially with somebody who is as protectionist as Navarro is in the White House. And the other thing I will say to you is that, and I've made this case for some time now, is that the quickest way for the administration to provide the American businesses and American consumers with a tax break is for them to temporarily suspend their 232 and 301 efforts. At a time when the world is all getting crushed, if they just took a 90-day detente on those, you would immediately put back into businesses that are being crushed from a million different directions, cash that they would otherwise be expending to pay the U.S. government tariffs. And, you know, the administration doesn't see it that way. They continue to believe that no matter what happens, no matter how many businesses go out of business or people die in this country, we should continue on our path of this trade war. And I frankly think that that's mistaken, particularly since they're starting to release some of the rules around medical equipment. But medical equipment, when we first started this crisis, was among the products that were caught up in the trade war. And so, you know, this administration has as much themselves to blame for their inability to access global supplies as they do any other foreign country.
Well, thank you so much. I mean, this is really, it's great to get your perspective, to hear your insights, and you're at the table having these conversations, and it's Heath was talking before about your Blue Dog roots and that important voice in the Congress today. So we are always so delighted to have you with us, and very much appreciate hearing your thoughts, and certainly wish you really well, both in the Orlando area and Florida with your constituents there who are facing this crisis head on right now. And certainly as you continue to do your work in Congress, working on legislation, helping the country respond to this pandemic, we're very, very appreciative of you taking some time and to being, once again, a great guest with us here today. Congresswoman Stephanie Murphy, thank you for being with us.
Thanks so much, Mike and Heath. Great to be with you all, Baker. And for my constituents, my office door is always open. Feel free to give me a holler if there's anything specific you'd like to have us know or work on your behalf. Thanks so much.
Will do. Thank you,
Stephanie.
Thank you very much. So Heath, just a couple of closing comments here. Congresswoman Murphy, of course, just another great guest. Really enjoy always having a chance to have a conversation with her, and we're going to keep this going. On Thursday, as we mentioned, we're going to have Congressman Josh Gottheimer with us. Like our guest today, Congressman Gottheimer has emphasized bipartisanship since he's come to Congress. He's somebody who really works hard on talking to folks on both sides of the aisle, tries to bridge some of those partisan gaps. His home is in Bergen County, New Jersey, and as a New Jerseyan, I know very well Bergen County and a lot of areas in New Jersey having a very, very tough time with this virus. He himself actually just came out of self-quarantine last week after a bit of a scare. He had also been exposed to someone who had the virus. So we're thankful that he is also going to make some time, Heath, to spend with us on Thursday.
Yes, Mike, this has absolutely been great, even though we couldn't have our in-house Washington, D.C. visit with everyone. It gives a great opportunity to really hear in depth, in detail, folks like Stephanie and Roy Blunt. It has absolutely been incredible, just the insight and knowledge that they're bringing and being able to help us with all of our clients has been great. So, Mike, again, thanks for your great leadership, and this has been a great webinar again today.
Well, it's always great to be with you, my friend, and this is just the second in our installment of BakerHostetler, bringing Congress to you. Our next installment, next webinar with Congressman Josh Gottheimer will be this Thursday, April 9th. It'll be at 12 noon Eastern time, 12 noon in Washington time. And I have to say, Heath, I'll give a little teaser for next week. We have a couple of very exciting guests that we're in the final stages of securing for next week's webinars after we have our next webinar with Congressman Gottheimer on Thursday. So until Thursday, Heath, be safe, best to your family, and we look forward to having our audience. Thank you, Heath. Look forward to having our audience join us again on Thursday at 12 noon, April 9th, for Congressman Josh Gottheimer. Thanks so much. Take care.